People in this video, look at this question. Anatomical basis for thrombus formation in right atrium. Why in right atrium there can be thrombus formation? They're asking you anatomical reasons. Okay. So first understand this. The right atrium is something that receives blood from the body, right? Superior vena cava, inferior vena cava. It receives even the veins, cardiac veins themselves drain into the right atrium. So right atrium is receiving a lot of things. So any thrombus anywhere, it will reach right atrium, correct? In the heart, first place it will reach us the right atrium. Okay, then in the external features, you have read that here you have the right auricle, correct? You see this extension here, you have some right auricle here, right? This, and then here you have something called as a muscular ridge between the superior vena cava and the inferior vena cava. You have a crista terminalis, right, which is in this groove called sulcus terminalis. Okay, it causes a groove called sulcus terminalis where you have the SA node, correct? So this muscular band also could be one reason for the thrombus to form. Okay, then we just now told you that there is a sinoatrial node here, sinoatrial node here. This itself can lead to what? Fibrillation, atrial fibrillation, which can lead to a thrombus or clot in the right atrium. So you're understanding why and all there can be a thrombus or a blood clot in the right atrium, correct? Next. In the internal features of the heart, you have seen that there are in the posterior wall, a lot of openings are there. The superior vena cava is opening. The inferior vena cava is opening via the eustachian valve. The coronary sinus is opening through the Thebasian valve. Then you have a lot of venae chordae minime, right, which are draining into this, because that drains actually all the four chambers and then it opens into the right atrium finally. So the right atrium is having so many openings, you can understand, correct? So that is the posterior wall has all those openings. Anterior wall, what happens? It is actually rough. Anterior wall you're not able to see here, right? In this diagram, because we have shown you a cut diagram here. So anterior wall is actually rough and pectinate. So it is having muscular ridges, okay, called as musculi pectinate. Okay, so you can understand it is a rough. So there's a lot of nidus in the right atrium for thrombus formation. Okay, then the septum itself, the interatrial septum itself has what? It used to have the foramen ovale in the fossa ovalis, around which you have the annulus ovalis, etc. So many structures there. You're able to understand. So all these reasons, all these things can be a nidus for thrombus formation in the right atrium. Okay, then what other reasons can be there? Okay, not anatomical exactly. So basically, sometimes they will put central venous lines, right? You would have seen in ICU, etc. That can be a cause. Medical devices, some mechanical valves, some people can have pacemaker leads, the electrodes, whatever they are calling, right? So those things can be the nidus again for thrombus formation. Then if there's endothelial damage, atrial fibrillation, stasis of blood, hypercoagulable states of blood, so the blood itself is hypercoagulable, all those can lead to thrombus in the heart, especially in the right atrium, which we are focusing now. Okay, so I hope this question you will be able to answer in the exam. Basically, remember the right atrium receives blood from so many things. So it is the first place that a thrombus can even reach if it has formed somewhere else. And so many openings here, so many types of valves, and then I told you muscle, crista terminalis, and then what is that? You have the muscular ridges in the anterior wall, then some right auricle you have, then you have the sinoatrial, interatrial fossa ovalis, etc. So many things that can finally lead to this thrombus formation in right atrium.